Hi, I'm Dr. Hal Blumenfeld. We're going to demonstrate here how to perform a neurologic exam. The neurologic exam is a powerful diagnostic tool that can be used to answer many important clinical questions. For example, if a patient collapses on the street, do they have cardiac disease or an intracranial hemorrhage? If a patient develops weakness and numbness of the legs, do they have a peripheral nerve problem or impending spinal cord compression? These are the kinds of questions that can be answered with a neurologic exam. Before we begin, it is important to emphasize that the neurologic exam is just one part of the clinical evaluation. Although we will describe the neurologic exam here separately, in reality, the neurologic exam should be performed and interpreted in the context of a more general clinical assessment, including the patient history and a general physical examination, of which the neurologic exam is just one part. A unique feature of the neurologic exam is that it tests function. Because of this, for each part of the neurologic exam, several tests should be done, ranging from easy to the most difficult. The idea is to titrate the patient's level of function so that it can then be compared to follow-up examinations. Although there are some variations in style from clinician to clinician, the format we will describe here is fairly conventional and consists of the following 6 parts: mental status, cranial nerves, motor exam, reflexes, coordination and gait, and finally, the sensory exam. In this video, we will demonstrate how to perform each part of the neurologic exam. Students should also consult the textbook, Neuroanatomy Through Clinical Cases, or the website, neuroexam.com, to learn the anatomical basis and clinical interpretation of the exam. The neurologic exam demonstrated on this video is significantly more detailed than that used in general practice. Depending on the clinical situation, certain parts of the exam may be performed in greater or less detail, or the order of the exam may be changed to fit the clinical situation. Learning how to use the neurologic exam as a flexible tool and learning how to tailor the exam to the specific clinical situation comes with experience and with practice.
I'm going to ask you some simple questions that are going to test your memory and your thinking. Can you please tell me the months of the year starting from January?
January, February, March, April, May, June, July, August, September, October, November, December.
Very good. Now can you say them backwards, please?
December, November, October, September, August, July, June, May, April, March, February, January.
Very good. Can you tell me your full name, please?
Milena Pavlova.
And what year is it right now?
2000.
And what month is it?
July.
And what is today's date?
The 25th.
And where are we right now?
At Yale New Haven Hospital.
Very good. I'm going to give you 3 words to remember, and I'm going to test you on those words in about 5 minutes. I use a timer after I give the words to ensure that I remember to ask the patient the words after a fixed interval. Please remember hat, chair, and Chicago. Can you say those back to me now, please?
Hat, chair, and Chicago.
Very good. Let's set my timer and give other tests to distract the patient so that she doesn't rehearse them in the interval. My timer goes off, and then I would say to the patient, do you remember those words that I asked you before?
Hat, chair, Chicago.
Very good. Can you please tell me the name of the president?
William Jefferson Clinton.
And before that?
George Bush.
And before that?
Ronald Reagan.
And before that?
James Carter.
And before that?
Ford.
And before that?
I don't know.
Okay, very good. Can you tell me what it was like when you were growing up in the place that you grew up?
I grew up in Bulgaria.
Uh-huh.
This is a country in southeastern Europe.
Mm-hmm.
And I grew up in a medical family.
Uh-huh.
My father was an engineer. My mother was a physician.
Uh-huh. Okay.
I had an interesting childhood.
Thank you. Close your eyes, please. Open your eyes. Stick out your tongue. Good. Okay. Point to the door, please. Good. Point to the floor, please. Good. Point to the source of illumination in this room. Very good. I'm going to ask you to name a few things, okay? Can you please tell me what this is called?
You're putting on a watch,
Good. And what's this part of it called?
the face,
And what's this part of it called?
the wristband,
And this part?
the clasp,
And this is called a...
tie,
And this part?
the knot.
Very good. Please listen closely and repeat exactly what I say. House.
House,
Hospital.
hospital.
Today is a nice day.
Today is a nice day.
No ifs, ands, or buts.
No ifs, ands, or buts.
Very good.
A newspaper or magazine can be a useful tool for evaluating reading, face and picture recognition, and visual neglect. To test reading, ask the patient to read individual words, headlines, and complete paragraphs aloud, and then test for comprehension.
Can you please write your name? Can you please write a sentence? Thank you. Can you please tell me what 5 minus 2 is?
3,
What's 2 times 4?
8,
Now here's a hard one. What's 54 divided by 3?
18.
Very good. Can you touch your right ear with your left thumb, please? Very good. Okay, can you show me how you would brush your teeth, please? Can you show me how you would comb your hair? Can you show me how you would throw a baseball? Can you show me how you would strike a match and blow it out? Can you show me how you would open a can of soda and take a drink? Very good. Can you please draw the face of a clock, filling up the whole page, and also please draw in all of the numbers? Very good. Can you please divide this line right in half? Thank you. Can you please cross out all of the lines on this page with a single mark on each line? Thank you. Can you please copy this picture right next to it? Thank you. Okay, I'm just going to test your hands for a minute here. All right. Very good. Can you please make a fist, tap your hand on your thigh like this, and then do this and that, then repeat that sequence over and over again as fast as you can. Very good. Can you please copy this sequence and continue the same sequence to the end of the page? Very good, thank you. I want you to take your hands, please, and rest them on your thighs. And when you hear one tap, I want you to please pick up your right index finger once and put it right back down again, just like that. Ready? Very good. Now when you hear two taps, please don't move your index finger. Just keep it still. Okay, let's try that again. Okay. Ready? Good. Good. Now I'm going to mix them up. Ready? Very good. Can you tell me how an apple and a banana are alike?
They're both fruits.
Can you tell me how a car and a boat are alike?
They're both objects that provide transportation.
Right. And if Mary is taller than Jane and Jane is taller than Anne, who's the tallest?
Mary.
Right.
The patient should be assessed for auditory, visual, and other hallucinations, as well as for delusional thought processes. Mood and affect should also be assessed through specific questions, as well as through nonverbal cues and social interactions occurring throughout the patient interview.
Can you please cover the right side of your nose, your right nostril? Close your eyes and tell me what you smell.
Soap.
Okay, very good. Cover your other nostril, please. And tell me what you smell.
Coffee.
Very good. To view the fundus, an ophthalmoscope is used, and the patient is asked to look straight ahead while the eye is approached at an angle of approximately 15 degrees. Please look straight ahead. Very good. Can you cover your right eye, please? What color is this?
Red.
Cover your other eye, please.
Red.
Does it look the same color with both eyes? Switch
Yes.
back and forth quickly. Does it look the same?
Yes.
Thank you. Look right at my nose, and I'm going to check your visual fields, okay? I want you to tell me how many fingers you see in each hand.
1. 1 and 1. 1 and 1. 2. 2 and 1. 1 and 2.
Very good. Tell me which side you see the fingers wiggling on.
Your right.
Point to the fingers that are moving.
Both. Both.
Very good. In patients who have impaired mental status who cannot cooperate with the visual field examination, blink to threat can be used. Although this patient has intact mental status, I'll demonstrate this now just to show the movements that are used. Look straight ahead, please. To test pupillary responses, shine the flashlight on each eye and measure the diameter of the pupil in millimeters, noting also its shape in the eye the light is flashed into, as well as the consensual response in the opposite eye. The swinging flashlight test is performed by swinging the flashlight back and forth between the two eyes. Can you look at my finger, please? And observe the pupils as the fingers move towards the eye and away from it. Please look at my fingers and follow them with your eyes. Look right at me, and now I want you to look at my thumb without moving your head. Look at my finger, back at my thumb. Without moving your head, look at my finger, thumb, finger, thumb, finger, thumb. Good. Now look at my thumb, finger, thumb, finger, thumb, finger. Very good. Please look straight ahead and count the stripes as they go by in front of your eyes. Very good. Good. And one more time. Very good. In patients with impaired consciousness, the eye movements as well as the vestibular system can be tested with the oculocephalic maneuver, in which the head is moved side to side. It's important to ensure that there's been no cervical trauma prior to performing this maneuver. The head is turned rapidly from side to side while observing the patient's eye movements. It can also be done moving the head forward and back. In the normal conscious individual, the reflex eye movements in the opposite direction of the head turning are not seen. Does this feel the same or different on both sides?
Feels the same.
Okay. How about here and here?
Feels the same.
And here and here?
Feels the same.
Please close your eyes and tell me which side I'm touching.
Left, right, both. Left, left, both.
Good. The corneal reflex is tested by having the patient look up and using a cotton-tipped swab. Can you please clench your jaw tight like this? Good. And I'm feeling her masseter muscles, and relax. And again, clench and relax. Open your mouth slightly and relax. Very good. Do you know any good jokes? Okay, let me see all of your teeth, please. Good. And puff up your cheeks. Good. And close your eyes real tight, and don't let me open them. Close your eyes tight. Very good. Taste can be tested with salt, sugar, lemon juice, or similar materials on the cotton-tip swab against the side of the patient's tongue, like this. Please close your eyes. What do you taste?
Sugar.
Very good. And what do you taste?
Salt.
Very good. Close your eyes, please. Tell me which side you hear my fingers rubbing on.
My left.
Right.
This one.
Right.
Both.
Very good. Okay. Do you hear this?
Yes.
Is this louder or is this louder?
The first one.
Okay. And is this louder or is this louder?
The first one.
Very good. Do you hear this louder on one side than the other?
No, it feels equal.
Thank you.
Both sides.
For positional testing to detect abnormal vestibular function, the patient sits near the edge of the table. The head is turned in one direction with one ear down, and then supporting the head, the patient is asked to rapidly lie back, and eye movements are observed looking for nystagmus while the patient reports any symptoms of vertigo. Once the eye movements and vertigo have abated, the patient then sits up, and the same eye movements and symptoms are reported. The normal individual has no nystagmus or vertigo with this maneuver. The maneuver is then repeated with the head turned in the other direction. Open your mouth, please. Say ah.
Ah.
Very good. Please say pa 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 pa.
Pa 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 pa.
Good. Ta 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 ta.
Ta 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 ta.
Good. Ga 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 ga.
Ga 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 ga.
Very good. Please turn your head that way. Don't let me push it back. Good. Please turn your head that way. Don't let me push it back. Good. Please pick up your shoulders like this. Good. And please move your head forward and don't let me push it back. Very good. Please stick your tongue straight out. Okay. Good. Okay, I'm just going to test the tone in your arms, please. Can you relax? Very good. Relax. Very good. Tone in the legs can be tested by asking the patient to please relax, and then suddenly bending the knee. Normally, The heel drags right along the surface of the bed with normal muscle tone in the legs. Can you please hold your hands out straight in front of you like this, as if you're holding a tray of pizza? Very good. Now close your eyes and keep them right there, please. Very good. Now can you please shake your head back and forth as if you're saying no? Very good. Can you please take your right fingers and tap them as quickly as you can like this? Very good. Now can you do the same thing with your left fingers, please, just like that? Very good. Can you take your right hand and pretend you're screwing the light bulb as fast as you can, please? Good. Now can you do the same thing with your left hand, please? Very good. Now can you take your right hand and tap it on your thigh as quickly as you can like that, please? Very good. Now the same thing with your left hand. Very good. Hold your right heel on the floor and tap your right toes on the floor as quickly as possible like this. Very good. Now the same thing with your left foot. Very good. When testing strength and reflexes, it's crucial to always test one side and compare the same muscle in the other side. Please hold your arms out straight like this. Don't let me bend your fingers. Keep them straight. Very good. Keep your fingers together like that. Don't let me pull them apart. Very good. And spread your fingers apart. Don't let me push them together. Very good. Turn your hands over like this. Touch your thumb to the base of your pinky. Same thing here. Very good. Make a fist like this. Don't let me push your wrists down. Very good. Push down. Very good. Go like this, please. Don't let me pull your arms out. Very good. Now push me away. Push strong. Push strong. Very good. Go like this. Keep your arms up. Keep your arms up. Very good. Keep your fingers very straight and don't let me bend them. Good. Okay, now spread your fingers apart like that. Don't let me push them together. Good. Now push your fingers together. Don't let me pull them apart. Good. Now turn your hand over, please. Take your thumb and touch it to the base of your pinky. Don't let me pull it out. Very good. Now push your thumb up like this. Don't let me push it down. Very good. Okay. Now, try and bend this finger. 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 Very good. Okay, make a fist. And don't let me bend your wrist. Bend your wrist forward. Don't let me push it down. Don't let me push it down. Good. Turn your hand over. And don't let me push your wrist down. Keep it up strong. Very good. Please pick up your right leg straight and don't let me push it down. Keep it up strong. Good. Other leg, keep it up strong. Very good. Okay, bend your knees slightly, please. Both legs. Good. Now, don't let me bend your leg. Kick it out. Strong. Good. Don't bend your leg. Kick it out. Strong. Okay. Now, don't let me straighten your leg. Try and bend it. Good. Try and bend your knee. Good. Push your knees out, please, as strong as you can. Good. Push your knees together, please, as strong as you can. Bend your foot up towards your face, please. Don't let me push it down. And the other foot. Toes up towards your face, please. Don't let me push them down. And the other foot. Now, push your foot down towards the floor. Don't let me push it up. And the other foot. Very good. Push your foot out against my hand, please. Very good. Turn your foot in against my hand, please. Very good. When testing reflexes, like testing muscle strength, it is crucial to test the corresponding reflexes one after another so that the two sides can easily be compared. Can you please let your arms relax in your lap? I'm going to test the biceps reflexes, brachioradialis, triceps reflex, let your arm relax, patellar tendon reflexes, and Achilles tendon reflexes. Very good. Test the plantar response using a sharp object such as the back of a reflex hammer and drawing it straight from the heel along the sole of the foot in an arcing motion towards the toes, and observe the first movement at the proximal joint of the great toe. The normal response is flexion. Extension is the abnormal response, also called the Babinski sign. Finger flexors can be tested by flicking individual fingers. The abnormal response, or Hoffman sign, would be flexion of the fingers in response to this test. Another way to test this is by gently tapping the palm with the reflex hammer and looking for finger flexion.
Additional reflexes are tested in special situations, such as coma, spinal cord injury, frontal lobe dysfunction, and neurodegenerative disorders. These reflexes, as well as their interpretation, are discussed further in Chapter 3 of Neuroanatomy through Clinical Cases.
Can you please take your hand and tap your thigh like this, and with the back of your hand like that, and then the other side alternating as quickly as you can, as fast as you can. Now with the other hand, please. Very good. Can you please take the tip of this finger and tap right on the crease of your thumb as precisely as possible, right there, as quick as you can. Very good. Can you please, with your right index finger, touch your nose, and then touch my finger, and touch your nose, and go back and forth as fast as you can. It's important to ensure that the patient uses the full extent of their reach when doing this test. And to bring out more subtle abnormalities, I'm now going to make the test harder by moving my finger each time. Very good. Please take the heel of this foot, put it on your knee, and drag it down a straight line to your big toe and back up again. Just like this. There you go. Straight down to your toe and back up again. Down to your toe and back up again. Very good. Now let's do the same thing on the other side. And up again, and down. Very good. Can you put your arms on your thighs like this, please? When I say go, I want you to please pick up both your arms to the level of my hand right there and hold them right there, please. Okay, ready? Go. Perfect. Can you please pick your arms up above your head, and when I say go, please bring both arms down quickly and stop right at the level of my hand. Ready? Go. Perfect. In the Romberg test, we remove visual input so that postural balance must be maintained entirely based on vestibular sense and position sense. Can you please stand with your feet close together, touching each other? And now close your eyes, please. Very good. Keep your eyes closed. Very good. Walk towards me, please. And turn around, please, and walk towards the wall. Walk back towards me, please. Turn around and walk towards the wall. Now, can you please take your heel and touch it to your toe with each step as you walk? Very good. Now can you do that backwards, please? Can you please walk on the outsides of your feet? Can you please walk on your toes? And can you please walk on your heels? Can you please hop on your right foot? And can you please hop on your left foot? Very good. I'm going to use a safety pin to touch the sensation of sharpness, always using a new safety pin for each patient. And first I'm going to ask you, does this feel the same or different on the two sides?
It feels the same.
Okay, and how about here and here?
It feels the same.
Okay, and how about here and here?
It feels the same.
Okay, now turn your hands over with your palms up, please. Please close your eyes and tell me if this feels sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull.
Temperature sensation can be tested with a metal object cooled in ice, with the other side kept at room temperature for comparison. Does this feel cool to you?
Yes.
And how about on this side?
Yes.
Okay, can you please close your eyes and tell me if this feels cold or warm?
Cold. Cold. Warm. Cold. Warm. Cold. Warm.
Very good. Test vibration sense using a tuning fork on the fleshy parts of the digit and not on the bone. Testing on the bone is conducted more proximally where the vibration can be detected much more easily. Close your eyes, please. Do you feel this vibrating?
Yes.
How about now?
Yes.
Do you feel this vibrating now?
Yes.
How about now?
Yeah. No.
How about now?
No.
How about now?
Yes.
How about now?
No.
How about now?
No.
Very good. Testing joint position sense in the normal individual requires only subtle movements, barely visible to the eye. Grasp the patient's digit by the sides so as not to provide tactile cues. Please tell me whether I move your finger up or down. Close your eyes, please.
Down. Down. Up. Down. Up. 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 Down.
Very good. 2-point discrimination can be tested using a caliper or, as in this case, a bent paper clip. Close your eyes, please, and tell me if you feel 1 or 2 points.
2. 1. 2. 2. 1. 1. 1. 2.
I would then measure this distance with a ruler. Close your eyes, please, and tell me what number I'm writing in your hand.
1. 3. 7.
Very good. Close your eyes, please, and tell me what you feel in your hand.
A paper clip.
Good.
A coin.
What kind of coin?
Probably a quarter. A pen cap.
Very good. To test for tactile extinction, test individual body parts on the opposite sides of the body and simultaneously. To make the test more sensitive, test different body parts such as the face and the hands at the same time. Please close your eyes and tell me where I'm touching you.
Right hand. Both hands. Left hand. Left hand. Both hands. Left side of the face and right hand. Left side of the face. Left side of the face and right hand. Both sides of the face. Left hand. Left hand and right side of the face. Right side of the face. Right side of the face. Right side of the face and left hand. Both hands.
Very good.
Now that you have learned how to perform the neurologic exam, review the neuroanatomy of each part of the exam so that you can better interpret the results. Finally, the best way to learn and understand the neurologic exam is to apply it in clinical practice.